Hi guys, Dr. Nick here. Today I just wanted to give you kind of an overview of the key things that I learned this past weekend in my most recent biological medicine workshop with Dr. Ralf Oettmeier from Switzerland from the Alpecin Clinic. I think the biggest thing that he always talks about that I do really appreciate now more than ever before, because I think he was one of the first ones that introduced it to me, was utilizing healing affirmations whenever you're doing a therapy to a patient in office. So I didn't really used to do that as much or really think about it as much. I thought affirmations are important. We should be doing them whenever we can. And I try to support my patients by giving them handouts on it, but I never really went into doing it on a daily basis in office with patients because I guess maybe I was afraid patients wouldn't take it as a positive thing. But what I really understood is that it's so important to be able to finish a therapy on a positive note. No matter what type of therapy you do, it's always important to bring that healing to a conclusion so it can spread out throughout the rest of the day after the therapy has been done. So an example is that when, say, we do a therapy on the liver, then maybe we will do an affirmation with the patient on the liver in terms of supporting it and making it work to its optimal effect. And I learned a lot this weekend, as always, with Dr. Ralph in his eccentric ways of kind of teaching. Of course, it's very funny. But I think the biggest thing behind everything we do is that we can't forget the person in front of us, the patient. And I think the healing affirmations also gives an empowerment to the patient in order to help um, or take part in their own healing. So when we do the affirmations, it does help support them as much as it helps the doctor kind of get the message across. So I think more than anything, this weekend, like I said before, is I learned again and just kind of hammered it in my head that I should be doing more affirmations with patients in office whenever we're doing therapies. So I hope that makes sense to you, and hopefully some of your doctors or practitioners actually utilize that and do it with you. But I think my job is now to kind of put into practice more than I have in the past because I think it's so interesting. And I guess I've been thinking about this just because reading also Dr. Ralph's book, this nice one right here, as I showcased before, Say Yes to Life. And looking inside, as you can see, there's a lot about the emotional state in terms of the patients and in terms of disease states. So we can't forget that because it's always difficult to go through such traumas, or especially when they're chronic and it seems like there's no hope. Because from my perspective, I always think there's hope for patients no matter what state they're in. We just have to start. So, hope you enjoyed. Thanks for watching, and hopefully, I can talk more about this in the future.